Hello, I'm Dr. Justin Kane, a board-certified orthopedic surgeon specializing in foot and ankle surgery at the Orthopedic Institute of North Texas. Today, we're going to discuss midsubstance Achilles tendon ruptures and their surgical treatment, a condition I frequently treat in my practice. The Achilles tendon is the largest and strongest tendon in the human body, connecting your calf muscle to your heel bone. A midsubstance rupture typically occurs 2 to 6 centimeters above where the tendon inserts into the heel bone. These injuries most commonly occur during athletic activities, particularly in middle-aged weekend warriors who participate in sports like basketball, tennis, or racquetball. When an Achilles tendon ruptures, patients often describe hearing or feeling a pop in the back of their ankle, followed by immediate pain and weakness. Many patients report feeling like they've been kicked in the back of the leg, even though no one was near them. Walking becomes difficult, particularly push-off with the affected foot. The diagnosis of an Achilles tendon rupture is primarily clinical. During examination, we typically find a palpable gap in the tendon and weakness with plantar flexion or pointing the foot downward. A Thompson squeeze test, where squeezing the calf muscle fails to cause the foot to point downward, is a reliable indicator of a complete rupture. While MRI isn't always necessary for diagnosis, we may use it to determine the exact location and the extent of the tear, which helps with surgical planning. Based on current literature and my experience, surgical treatment offers several advantages for active patients. These include a lower re-rupture rate, better strength recovery, and more predictable healing. For my preferred surgical technique, we are able to keep patients lying on their back, which is safer from an anesthetic standpoint. The surgical procedure involves making an incision along the inside border of the ankle along the Achilles. We identify the torn tendon ends and use strong sutures to reconnect them. We use specialized techniques to ensure the repair is both strong and allows for early protective motion. This is crucial for optimal healing. One of my preferred techniques involves using a strong core suture configuration combined with peripheral sutures. This provides excellent stability while maintaining the tendon's natural length and tension. For athletes and active individuals, this approach allows for a more predictable return to sport and daily activities. After surgery, the postoperative recovery typically follows a structured protocol. For the first 2 weeks, patients are immobilized in a splint. At 2 weeks, most patients transition into a removable boot with early protected motion and advanced physical therapy protocols. During this time, physical therapy works on weight-bearing activity, scar desensitization, and core training in anticipation of resuming normal active lifestyle. At around 8 weeks, patients typically return to regular shoe wear and continue with physical therapy modalities aimed at returning patients to their previous lifestyle. Unrestricted activities are allowed at 3 months. However, it is important to note that with any Achilles tendon rupture, a full recovery can be expected by about 12 to 14 months. The key to successful recovery is following a carefully structured rehabilitation program that balances protection of the repair with appropriate motion and strengthening. While Achilles tendon ruptures are serious injuries, with proper surgical treatment and rehabilitation, most patients can return to their previous level of activity. If you're experiencing an Achilles tendon injury, it's crucial to seek prompt evaluation from a qualified orthopedic surgeon to determine the best treatment approach for your situation. Thank you for watching. For more information about Achilles tendon injuries or to schedule a consultation, please visit our website at www.oint.org or contact our office at 972-591-6468.